Life is full of expenses. Isn't that true? Every day we spend money that we wish we could have back. And chances are in your own life, one of your highest expenses is going to be healthcare, even if you don't have a major medical problem. The National Coalition on Healthcare reports that it's probably going to cost you between $3,000 and $5,000 a year for your healthcare if you have no medical problems. Also, a study in Health Affairs, a magazine related to health issues, found that over 2 million Americans went bankrupt for one reason: medical debts. And these medical debts are often intertwined with insurance problems. And the 2006 United States Census found that over 47 million people in America don't have health insurance. That's like having 24 states of Utah without one person who has health insurance. And in this country, not having health insurance means if you have a medical problem, you're going to go into debt. Despite this, insurance companies report millions upon millions of dollars of profit every year. Somehow companies out to make money got put in charge of our health care. So what's the solution? What's the answer to medical debt, to this insurance problem? Well, one answer is socialized medicine. Now, feel free to give a groan about socialized medicine. I know it's a hot topic. But before you get your pitchforks and torches, let's talk about some of the issues with socialized medicine. Some people object to socialized medicine because they say there would be long waits. It would take forever to get anything done. I hate to ruin your fantasies, but we already have that problem in this country. In 2006, a woman named Beatrice Vance died in an Illinois ER waiting to be helped. They couldn't get to her fast enough. They were understaffed. Unfortunately, this is not an isolated incident. It's happened before, and it's probably going to happen again. In my own life, I've been trying to get a piece of medical equipment for which I have a prescription, but my insurance company has denied me 3 times. Each time it's taken them over 2 months just to send me the rejection letter. And I can't move on until I have this rejection letter. They have wasted almost a year of my time. So we already have the long waits without any of the benefits of socialized medicine. Other people are opposed to socialized medicine because they say taxes would be higher, and that's why we shouldn't do it. And it's true, taxes would be higher. But if you take the money you would have spent on health insurance premiums, doctors' copays, prescription drugs, you'll find you'll save money, not lose it. Again, the National Coalition on Healthcare reports that to insure the average American family, it costs over $12,000 a year. If we take that number and divide it in half, so now you, your businesses, and the government are all paying half of what you used to, a grand total of only around $6,000, the United States would have over $1.8 trillion for a healthcare system, more than enough by the most expensive standards. Michael Moore talks about some of these objections and these issues in his movie Sicko. And although Michael Moore is not the best source to go to for many topics, he does bring up some good points in this movie. And one of the best things he does is he compares life expectancy by country to per capita health expenditure by country. And as you can imagine, the United States spends the most per capita on healthcare. However, we don't have the best life expectancy. Countries in Western Europe with socialized programs spend far less than we do for a better life expectancy. And even Cuba, whose healthcare system is far from perfect, spends less than 1/3 of what the United States spends on healthcare for a better life expectancy. And life expectancy is one of the best measures of a nation's overall health. So what are these systems in Cuba and Western Europe, these socialized medicine programs? Well, under socialized medicine, the government would be responsible, ethically and fiscally, for providing all of its citizens with health care. You would never pay for a doctor's copay again. You would never pay for a prescription drug again. You would never pay for a hospital visit again. People in hospitals have enough to worry about. They shouldn't have to wonder if they can afford to be in a hospital. In a socialized medicine program, you would still have a choice between doctor and hospital, much like we do now, where the insurance company tells us what services are and aren't pre-approved, only you would probably have more freedom instead of less. Other people like to say that because current socialized medicine programs aren't perfect, we shouldn't adopt socialized medicine, but I disagree. I think we have to take the good points of other countries' socialized medicine programs and find solutions to their problems, so that America has the best healthcare system in the world, so that Americans are the healthiest people in the world. We need to start thinking about these issues as we vote for laws, candidates, the 2008 presidential election. Find out what's important to you and compare with the candidates and vote accordingly. And at the very least, don't let your insurance company push you around. Ultimately, you and your doctor, not some company out to make money, should be in charge of what health care you get when.